Hey guys, it's Sally here, Strength for Dance, and what we're going to be looking at today is creating space but strengthening into the front of the hip. So I use this one quite a bit in clinic, and this has been part of 2 dancers treatment rehab programs for this week. So you will need a foam roller, or you can also use a yoga block. We're going to start off again with a test. And this is a version of a Thomas test, which is something we use in clinic to assess hip flexor length. So, lying on your back, pop the foam roller underneath the pelvis. We're looking for a nice long spine here. Going to draw one knee up and then the other, so that the pelvis is tucked backwards. Then just holding onto this leg, just lengthen your leg away and just see where it gets to. So if in this position it's hanging around here, it might give you an indication that it's a little bit tight. We want to see if we can allow the leg to lower. Not necessarily to touching the floor, because as you see, if I touch the floor, the whole pelvis tilts forward. But I just want to see, where does it go to and what does this feel like? Do I feel any areas of specific tension? Coming back up, holding on to this one and swapping over. So feels similar within my body. And then I'm going to use this same position to actually strengthen. So we're going to do a large bicycle-like motion. So holding on to this knee to keep the pelvis tucked back a little bit, we're going to lengthen up, lower the leg, and then slowly peel back in again. Lifting up, lower. Now, you need to make sure with all exercises that this isn't causing any pain. So if you're having treatment for anterior hip impingement, labral tears or anything like that, this is not something for you to be doing at home. It needs to be part of monitored rehab, because we need to be able to keep the hip joint centralized and not sliding and shearing forwards as we do this. And if you're having treatment for those problems, it's usually because your hip is sitting too far forwards and is not stable within its socket. If you want to, you can place your hand here and just monitor what is it I'm feeling. So I generally give out about 10 repetitions and then onto the other side. But because here we are lengthening the muscle under load, so eccentric muscle work, it's a nice way to create safe length within the tissues rather than sitting and hanging out into a hip flexor stretch. Curling up, slowly lengthening. The weight of your leg should be enough. Would hate to think that you're doing this exercise with ankle weights on. No. Okay, and then again, you can retest either literally here, so I actually feel like that goes a bit lower, or you can literally test with your movement and how nice does it feel within the body. Enjoy this one. Remember, no pain.